Couples counseling I love it, man.
Yeah?
I love it. Like, metaphorically, I got my popcorn, I got, I got my Pepsi. Like, yo, I'm like, so how did this week go?
And you just waiting for the drama?
Just like that. So.
Welcome to another episode of WeDriveHealth podcast, where we are steering health forward, and I'm here with Dr. Dexter Daniels. Daniels or Daniel?
Daniel, no S.
No S, right?
No S.
No F?
No S. There's only one me. No
Whoa, okay, I'll take
me.
that. Okay, I like that. So, how we met? One of my boys introduced me to you, and he was like, "Yo, I need you to meet my man. He's doing big things. He's getting his doctorate." I was like, whoa, doctorate? Let's go talk that talk. So tell me about that journey for you, bro.
Yeah, it was. I was definitely in the trenches during this whole process, man. For me, I really had no intentions on pursuing my doctorate, especially like after I got my master's. So I got my master's in social work back in 2014.
That's a big gap.
Yeah, it was a huge gap. We're talking like 7 years. I started my program fall of 2021 while we're still like in the midst of the pandemic, like during the lockdown. But for some reason, like I just had like this inkling, like this tug to like want to pursue more, right? Like the analogy that I used was that I want to be the Michael Jordan of social work.
Oh, okay.
Yeah.
Okay.
Like I need my 6 rings. So I was like, what is my 6 rings going to be? So I figured, all right, I got my bachelor's, I got my master's. One of my cousins had like pushed me to get my license, and I had no intentions on getting my license too. So I was like, all right, I'm good with my license. And then I was like, all right, now I gotta get my clinical license. So that's 4. And I was like, what's 5 and 6 gonna be? And I was like, I guess I gotta get this doctorate then.
Damn.
So I was flirting around with the idea, and then like one night I was on the computer, so I was just like, oh, let me see like what doctorate programs they have out there. And the one that I was looking for wasn't available at the school that I wanted to check it out at. But then there was this one particular program, like the opportunity pretty much told me you can't say no to this.
You have no choice.
You have no choice.
That's what we call providence.
Yo, it was online, part-time, and it was in-state too. So I'm like,
so you got those cheaper fees?
Yeah, man.
Yeah.
Definitely sticking with that in-state tuition. So,
Yeah.
So all these things put together, I was like, why not do it now? And plus, they waived the GRE too, because the last thing I wanted to do was like study.
Oh, so that's important.
Yeah, huge. I think that might have been like the deciding factor right there. So
nice.
yeah, so put all that together, I was like, I guess I'm gonna do it. So I did it.
So how long was that journey for you?
That was 2.5 years.
Oh, so it wasn't in my mind. For some reason, I'm thinking of like 3.5, almost 4. But yeah, that makes sense.
Yeah, I would say about 2.5 years, because I graduated this past May.
Got it.
Yeah.
Congratulations again, bro.
Appreciate that, man. Appreciate that.
So as you know, I have a nonprofit called Crown Kings for Men.
Shout out to Crown Kings.
Shout out to Crown Kings, and it focuses on emotional intelligence and communication. Well, obviously, one of the biggest things that you do is you communicate with individuals. So,
Right.
how would you describe your communication style when you're speaking to your clients? You call them clients or patients? Which one?
I say clients.
Okay, clients.
Yeah, I say clients. I reserve the term patients for medical professionals.
Got it. That makes sense.
Although there are some therapists that use the word patients, not saying that it's wrong for people to say that, but for me, I don't know. I just have a preference to say clients though. But yeah, for me, I'm actually much more of a listener than I am a speaker. Like I prefer to listen more than I talk, which I think only in this platform on a podcast, this is probably like the most people actually hear me talk for a long, extended period of time. Yeah, or unless like, we hang out or whatever the case is. And of course, we'll talk much more in depth. But I actually prefer to listen. I think listening is powerful. And to listen is a lot different than hearing somebody. Hearing, I like to say, is really just a body function that your body performs if you're capable of doing so, right? For me, listening is an act of intention. Like you're intentional about hearing what somebody has to say, processing what they have to say, and it also puts you in a position to practice empathy too. So for me, I like to listen more than I like to speak because my goal is to understand you.
Right.
No, you know what I mean? So, and a lot of times I find that people really just want an opportunity to, get some things off of their chest.
Right.
And not so much like hear rebuttal or, many times they don't even really want advice, to be honest with you.
Right.
You know what I mean? So I like to just sit back, let you tell me what you want to tell me, and then I'll take it from there.
So it's so funny because I think I told you growing up, my father was a psychologist.
Yeah.
So like that was like the path that I figured that I was gonna do. Then he told me about how much school I was gonna have to do, and then I'm probably gonna have to get my doctorate. And I was like, yeah, we're not doing that.
Yeah, that's what I said too.
We're not doing that.
So
then I ended up switching to nursing because it just worked better for me personally and
better you than me.
Yeah. So, but it's funny because everything that you just said, that's how I'm everything that you like. I'd rather listen than speak.
Right.
So even when I'm speaking, like I'm thinking about like, all right, I feel like I'm talking too long. Let me stop talking and let somebody else talk. So it's a weird timer that I have in my head.
I get it.
I see the countdown. It's like, all right, you talking too long. All
Yeah,
right, let the other person speak. So that's dope.
Yeah.
What is especially like, at least for in this space, right? So we did, for those who don't know, we ended up doing a appreciation event dinner for men. This is our third annual, and I think
dope.
I appreciate you coming out, bro.
Yo, I was so inspired, but continue because I'm gonna go off.
No. Tell that. I like to hear it. Go ahead, bro.
Yo, man, it was amazing just to enter into a space, and I'm honored that you even invited me to come check it out. But it was so dope just to be in the space amongst other black men who are accomplishing like really great things. And, you don't really see that in the media too much, unless it's other people that's pushing like their own agenda, like their own initiatives, which there are a lot of out there. And shout out to them because we need more of that. You know what I mean? So I believe that what you're doing with Crown Kings, like what you did with the event the other night, it's really pushing the narrative that I believe that needs to be put out there, especially about us as black men, because we are making some great things happening.
Right, and I'm be completely transparent. I didn't want to do it this year. I wasn't in the mental space. I wasn't going to do it, and my boy Dane was like, "Yo, you have to do it."
Yeah.
Like even if it's just a handful of us, and so it sparked an idea for me. I was like, well, you know what? I'm just going to invite a certain amount of people. And people who showed up for me in 2024, like that was really my thing. Like people who showed up for me in 2024. Yeah. And I was like, yo, you invite somebody that showed up for you. And I think what was interesting to me was like, when I was like, all right, so who you gonna invite? They were like, you. I'm like, bro, I'm already coming. Like, who else you have? And some of them was like, I don't got nobody else to invite. And I was like, that's crazy to me. So can you talk about like the lack of support that most men have? I think people in general have a limited amount of support, but definitely men.
Yeah, I think that there's a conversation to be had about how we define friendships and are we really evaluating and assessing the quality of the connections that we have with other people. And I don't think for men it's really as much of an issue for us to find people to connect with, or at least other men to connect with, because at least as far as I know, every man that I know has other boys that that they cool with, that they chill with, that they connected with.
So that's the thing, like they cool with them to a certain extent, right? Like, so it's like, all right, we could talk sports or whatever the case may be, but it's like surface level. That's the best way to put it, surface level. A lot of the guys that I've spoken to, there's like anything past that surface level, like, hey, what's going on? Like, that's it. Yeah.
So, I mean, those type of connections, there's a lot of that going on. So I think that's a really good point that you bring up. So perhaps the lack of support that you're probably referring to is like the lack of genuine connections, like deep.
Correct.
Deep connections, friendships that people have where you can actually call up your mans and be like, yo, I need a minute. But when people say, yo, I need a minute, it's more like 30, 45, maybe an hour, a couple hours.
That's a long time.
Bro. It is a long time, but I don't think people really plan to have those type of conversations or to have conversations for that long, because I don't think people really realize the magnitude of what it is that they're dealing with. And a lot of people need to unload a lot of stuff that they got going on, right? So if you have friends, or if you have family, or you have somebody that you can connect with, that you can share these type of things with, then that's great. And if you don't, I would highly recommend that people find a licensed professional to speak to, especially a mental health professional.
Like yourself?
Like myself,
I'm sorry.
Shameless.
Did you even name your business? Like, what were you talking about? Shameless plug, and you didn't even tell us the name of. You didn't even tell us the name of.
You threw up the alley.
I did. So go ahead.
All right,
Go ahead.
alley. So I am a licensed social worker in the state of New York. I do have my own private practice, which thanks to JT, Dr. Nate over at WeDriveHealth, called Abundant Life Counseling. So I do individual counseling, couples counseling, family, group. I'm going to be doing some mental health coaching as well, where, if you need a licensed mental health professional to talk to about anything that you're experiencing, I'm definitely the person that you could reach out to. You can find me at Abundant Life Counseling. That's life with a Y on IG. And you can also reach out to me at Dr. Dexter Daniel on IG as well too. And Absolute Life, AbundantLifeCounseling.com.
Yeah, we'll definitely put all the hashtags and links in the description for the bio.
Yeah.
Gotta have you get your numbers up.
I gotta get used to it because y'all put me on the spot. Y'all like, yo, let's make this happen.
So I'm gonna let the audience on a secret, right?
Yeah.
Like when we first met,
Yeah.
literally the first time they met, he was like, "I need you to retire me." I was like, "Wait, what?" You talk about pressure. I was like, I got you.
Yeah. Give them the context as to why, though.
I don't remember the context. The only thing I remember is retirement. I said, all right, cool.
Because I was working like 4 jobs.
Oh, yeah. That's true.
And
That's true.
Starting businesses like every 30 days. Like
Yeah. He was working.
Yeah.
So in terms of like just the friends though, right? Because so what I've been doing, especially in 2024, is I've been auditing my friends. All right, so like basically been categorizing them. Like, all right, this person. If I invite this person to something, the likelihood of them showing up is pretty low. But if I need them for something else, okay, I know that I can reach out to this person.
Right.
This person. We spoke about my man who actually catered our event. Jack.
Yep.
Yeah, my man Jack.
Shout out to
so
Jack.
I'll invite Jack to an event. My mans will not show up, bro. But if I need him 3 o'clock in the morning, like, yo, Jack, I need you to pull up. I'm going through.
He's there.
Without question. Like, yo, all right, what time? Like, so, and I realized, like, as you said, all friendships are different, but I started to, like, categorize everybody's like, all right, this is the person that when I need for this, he's the best person to go to. If I need some advice, he's probably not the best person to go to. Or if I need, like, and once I did that, I was like, oh, snap. Like, my network is pretty dope.
Yeah.
Like, my network is pretty dope. So
No,
going back to, like, when inviting and they don't have one person that supported them, it really, really hurt my heart. I was like, yo, this is crazy. Because I can tap into so many different people at any time.
But that's the thing, though. I believe the way that you connect with people, and I'm basing this off of, like, our friendship, right? Like, I could clearly tell, like, off the bat, you have no problem showing up as yourself, right? And I think there's a term for that. Many people would say authenticity. Many people would say that, well, I would decipher that as being vulnerable, right? Being vulnerable implies that you're able to show up as yourself without regard to, like, any embarrassment, any, like, shame or anything like that.
I like the word transparent.
Transparent, yes. And we talked about this too, right? But I didn't want to get into that though. But I think the reason why a lot of men don't have those type of quality connections or friendships, getting back to the question that you asked earlier, is because men don't like to be vulnerable.
That's true.
Right?
That's true.
I heard this said on a post the other day. Shout out to Jason Wilson.
That's my man.
I've been following this man for years, yo.
Yo, his books have been changing my life.
Yo, I would join his academy if I could. Like,
sure.
if he was in New York, like, yo, it'd be a different story. But he had talked about the reason why men are not vulnerable because he pulled up the definition of vulnerability or to be vulnerable, which pretty much implies to be open to attack. So if you're asking somebody to be vulnerable, by definition, what you're doing is you're asking them to be open to attack. And what man is comfortable with being open to attack? Like none, right? So I think that's the way that we've conceptualized what vulnerability is. And to a degree, I do believe that is the case, right? Because if you are vulnerable with somebody, you are giving them the opportunity, should they mishandle that, to hurt you in some kind of way, right? And that can go left really quick, especially for a man. Like I always said that if you fumble a man's vulnerability or his transparency, chances are you lost it.
So this is as we were having that conversation, I started thinking about it. It's like, for me, when you present yourself, you should be transparent, right?
Absolutely.
Like there should be like that first level of, I guess you would say, defense, right? Like if you're gonna have it, but then that next level would be the vulnerability, right? And everybody can't get access to that because of what you just stated, right? Because once that trust is broken, it's a wrap.
It's a wrap. Yeah. Like people, there's a tendency for people to mishandle that, right? And it's not to say that there aren't good people out there that don't know how to handle your vulnerability, like, or your transparency. Those are the ones that you want to connect with. But I think a lot of men are apprehensive to even take that chance for a variety of different reasons. Because I believe that everybody has a story, right? Their trust may have been broken early on in their life, maybe as a child, or even like into adulthood, whatever the case may be, depending upon like the severity of the situation or what took place, right? So some people, it's like one strike, you're out. Like, I'm not giving anybody else a chance to come back into my life, or to even give a new person a chance to come into my life, because I don't want to experience that hurt and pain again. You know, so a lot of guys are kind of apprehensive to that. And so I think that might be one of the reasons why you don't see as many strong connections between men. But it's out there, though. And I definitely witnessed it, you know, the other night at the gala, you know, at your event.
Yeah.
And I have my circle, you have your circle. I know other men that have their circle too, but we need to promote that more.
Yeah. I mean, even at the men's confidential meeting that we had last night, it was incredible, bro.
Oh yeah.
Like there was guys who the first time never been in a circle like that, where they were just able to just open up. Obviously, it takes time. Right? If you've never been in that situation, even I'm sure like as a therapist, people don't bare their naked souls the first. Well, maybe I should ask you, do people come in like bearing their naked souls?
Yeah, I've definitely had some sessions where, you know, they just come out the gate like,
just
damn, this is what we're dealing with.
Yeah.
I'm just like, yo, those type of sessions, they run the fastest for me. Like, those be like the fastest 45 minutes, because I'm like, there's so much information that I need to get. I'm just like, yo, but I got to remember, like, this is a process. We're going to get there when we get there. But yeah, you definitely have some that come in and they're just like ready to bear it all. And there's nothing wrong with that, though.
There's absolutely nothing wrong with it.
There's nothing wrong with that. You know, if you're doing it,
I'm sure as a therapist, you actually prefer that.
Absolutely. Like, let's cut to the chase. Like, what's going on here? Like, how can I help you? Tell me what's going on. I think some of the hardest sessions for me to work are the ones where people are just holding back all the time. You know, I've worked with people for over 2 years, and they're still like just scratching the surface of stuff that I know, or at least I'll say what I've been taught was I have a therapeutic hunch as to what took place, but they're not tapping into it just yet. But part of my game is be patient. I'm here.
So I have a question. I'm glad you brought that up, because now if you have a therapeutic hunch, right, is it okay, or is it acceptable for you to even open that door, right?
Oh yeah.
Like you know, say, oh, so what I'm hearing is so and so and so. Is there something that you want to expand, or have you ever experienced something like this that would cause you, like, how does that work? Yeah,
just like that. You know, sometimes you have to ask questions like straight up, you know, because you might have an idea as to like what might have taken place. And the only way to know is to ask. You know, worst thing that could happen is, you know, the person says, no, this didn't take place. And you'd be like, okay, all right. Because you don't want to leave like any stone unturned in session, right? And I think that there is a timing and a place, and there's a tact to it as well, which, you know, licensed, you know, mental health therapists have been trained on. But, you know, the important thing is that you stay with the client wherever they're at. Right, stay, as I was taught, you know, stay in their subjective experience, which is essentially like what being empathetic is, or practicing empathy is, right? You're staying in their subjective experience. And when they want to share, then that'll be the time for them to share. Don't force it too much. Of course, ask questions. That's what we're supposed to do. Right. But when the time is right, things will be revealed.
So what would you say is the hardest part of being a therapist?
I think on a personal level is for me to...
Well, we could do both.
But this is, so the two kind of go hand in hand. I think for me, the hardest part for me as a therapist is to manage my burnout. Because we are very susceptible to burnout. And you as well. People who are in the helping profession, therapists, nurses, doctors, teachers, what have you, we are very prone to burnout, right? And not only am I just a therapist, but I'm also a man at that too. So that's part of my identity, and I own the fact that I have a tendency of wanting to take on the world. Like I got 100.
Trust me, I understand, bro.
Like especially like as dads, right? That's a responsibility in and of itself, right? So as soon as I'm wrapping up my last session for the day, I'm automatically in dad mode. You know what I mean? So gotta make sure homework is checked and taken care of.
Right.
You eat, make sure he takes a bath, get him in bed on time, take him to school in the morning. You know what I mean? So many different hats that I'm wearing at the same time. And then also the fact that not only do my clients know that I'm a therapist, but my friends know I'm a therapist. My family knows that I'm a therapist. Dex, I got this going on. But as soon as I finish the session, I'm just like, yo, I need like...
Truth be told, I actually did this to him yesterday. I was like, yo, bro, you got a minute?
10 minutes.
Yeah, just 10 minutes, bro.
No, but it worked out, though, because I was waiting on a client that didn't show up. But I was like, I'll make space for you. You know what I mean?
All right, so noted. Noted. But it was actually very impactful. Like So I have, like, when I have certain conversations, I replay it over
after the combo's done.
After, like, maybe not in that moment, but like later
sometime later. Yeah.
I'll replay it, and I was like, okay, he said this. All right, cool. All right, he said that. Okay, cool. All right, that makes sense. And I'll just pick it apart. Like, and okay, well, why did he say it like that? Well, his facial, when his facial expression made that look right there, right? Like so I'm very like. My brain is constantly going.
I wonder how much your dad has to play a part of that, because I know you've probably watched him so much growing up and him being a psychologist.
My father's a different character, bro. my father.
Shout out to your pops. I met your dad.
You remember my dad?
So
him, he's a different.
I want to get some nuggets from him too.
He's a different dude. My father just be like, yo, I'm gonna give you this information. Yeah. I'm not interested if you like
whatever you do with it.
Whatever you do with it, you're just gonna take this information.
Right.
So yeah. Nah, it was a very interesting childhood, bro.
Yeah.
Just to say the least.
But that's why you're good at what you do, though.
Yeah, I agree. And one of the things, just to kind of harp on things just in terms of like that when we talk about like fathering, like I've never seen my father. I might have seen my father angry once. And even when he was angry, he was calm. And that was something that I like really like. I probably been red only once in my life.
Yeah.
Even like I've gotten into fights and stuff, I wasn't red.
Yeah.
Just one time in my life I got red. I was like, yeah, this ain't it.
Nah.
And I'm like, people stay on this level all the time. And I'm just like, this is madness. I couldn't imagine, because like this amount of stress that I felt on my body afterwards. And again, I'm replaying it, right?
Yeah.
And I'm like, yo, I should have responded this way. Should have did this differently. So I'm like, people are on red. So like, how do you deal with like when you have a client that's like red hot?
That's red hot.
Red hot.
Yeah, I've had some sessions. Normally those actually happen in my couple sessions.
Oh, that's right. Did you even mention you mentioned you do couples?
No, so I didn't. Well, I think I may have, but yes, I do individual as well as couples as well as groups, and also mental health coaching too. Couples counseling I love it, man.
Yeah,
I love it. Like, metaphorically, I got my popcorn, I got my Pepsi. Like, yo, I'm like, so how did this week go?
You just waiting for the drama?
Just like that. So just like that. You know?
Who usually jumps off first, the male or the female?
I would say it is more times than not is the woman starts it off.
That's on
women
brand.
started off. Yeah, which says something about or implies something about male communication, right? And I intentionally like wait to see who's gonna go first too, because I'm like, well, who's gonna bring it up? Who's gonna start it off? You know what I mean? But yeah, it's typically the couple sessions is where I'll see people get heated the most. Like people like screamed. I've had sessions I've had to be like, all right, we clearly didn't get anywhere today. We're gonna have to circle back on this next week. And it's kind of like my way of like gently checking them too, because I want them to reflect on how we ended the session. And then what happens is when they come back the following week, they're like, Doc, I just want to apologize to you.
Nice.
I know how things ended last week. It wasn't on a good note. I respect you as a professional. Like, I've had this happen like a few times, and I appreciate that, because what I want them to do is like practice self-awareness. And some of them are really great at it. Some of them, they can continue practicing it. But yeah, some of those sessions, like, they get crazy, son.
Yeah, I believe
They
it.
get
I
crazy.
believe it. I believe it. I'm just like you. The way how you sat back, you like, yo. So what we doing?
Yo, and I'm like, I do that in my head because I don't want to make it seem like.
Of course not, but you like, yeah.
Let's get to it. You know what I mean? Because I'm really big on active listening, and of course like taking things seriously too, because they're coming to me with some serious stuff, like marriages are on the line.
On the line, yo, and that active listening is that's a tool that I didn't know existed until I did this program called Momentum Education, and one of the he's actually the executive director of it. Like the first 5 minutes, I've never met anybody's active listening skills that is top tier, bro.
Yeah,
top tier. And I was like, yo, how do you do it? He's like, active listening. I did research on it. I was like, yo, this is a real skill. Like this is a real thing. So how did you develop your active listening?
I think for me it was very natural. For some reason, even like well before I even got into this field, I just had a knack for wanting to help people with their issues. And actually, shout out to my sister. My sister was actually the one who kind of pointed me in this direction. Because I remember when I went to college, I went in as a pre-med student. And I took chemistry my first semester. And I was like, this...
Got clapped? Yeah.
Bro. Yeah, I was in my advisor's office the end of that semester like, this ain't for me. So I had a conversation with her, and she was like, well, you're really great at helping people. And technically, I declared as a psychology major.
Got it.
Right, even though I was on a pre-med track, but I was still a psych major. And I was like, I don't know what to do. And she was like, you're really great at helping people. People come to you with their problems. You give really great advice. Why don't you consider like going to counseling as a profession? And it really just like started from there. But I've always noticed that like I like to be there for people, and I want to make sure that people feel safe when they want to talk about something that they're having an issue with, that they're really challenged by. And like I mentioned before, a lot of times people don't really want advice. I believe that a lot of times people know what to do already. They just need confirmation, or they just want to speak it out loud so that they can confirm themselves and affirm themselves, right? And that's powering in and of itself.
Correct.
You know what I mean? And just doing something as simple as just sitting there, eye contact, nodding, little smirks here and there, just to let them know, like, yo, I'm here with you. Right. And even doing like what you just did just now, like, I'm here with you, right? Like that's a form of active listening right there. Like that lets people know like they're not alone in this moment.
Or you repeat the last thing that they said.
Right.
Yo, bro, I love it, bro.
It's my secret
I wish,
weapon,
like, I don't want to say I wish. If I wasn't a nurse, I probably should have did it.
You would be phenomenal at it,
bro. I should have done that, Jay.
You could still do it.
Absolutely not.
Absolutely
not.
You can still do it.
Absolutely not. But I am clear that I need to be in the transformation space. Right. I'm clear about that. Like I love to watch people like come in and you just see their once, like you said, somebody comes in and they realize that somebody's actually listening to them talk, like their whole body, like they just shift and it's just like, like I'm listening to you, like tell me like how can I help you?
I saw that last night at the group. You know?
Yeah.
At first, like there were some men that were kind of like apprehensive about sharing, and then the more they realized like, yo, the mic is theirs, the floor is theirs, then they started sharing some more. Yeah.
And I think that's, to me, like when I created the confidential circle, it was a lot at first, right? Because I was doing it every week, and the stuff that I used to hear, I'm like, I'm not clinically trained for some of the stuff that I was hearing, but I'm like, most of the guys didn't have that another outlet. They didn't have a therapist. Right. And now, obviously, knowing you, like, now I'm going to send you, bro.
Thank you.
Bro. Bro. You think it sure is? What? Talk to my man.
Yeah.
So I think that is going to be amazing, because I think going to a space like ours that we have, the next step would be, like, really, like, going to a therapist. Because some people just don't really want anybody, in, quote, unquote, in their business.
Right.
And so I feel like our space is perfect for it to then say, listen, after hearing what I'm hearing, what you said, you might need to see somebody, because, it's a deep-deeded, and obviously you can still come or whatever the case may be. Yeah. But you definitely need to see a therapist.
People need to, like, take advantage of these opportunities.
And obviously, when we spoke about this, the therapy now is not this taboo where it's like terrible. Like I'm almost everybody I speak to now, they're like, yeah, I was speaking to my therapist. I'm like, oh, nice.
Yeah.
Good.
The conversation is transformed over the years.
Yeah.
And I love it.
Right,
Yeah.
right. And it's a whole different, it's a different world now.
Mm-hmm.
So I think I want to thank people like you who really like, sacrifice their, I don't want to say sacrifice, but donate their lives to helping others, because you are super important.
I appreciate that, man. And I would actually go as far as to say it is a sacrifice, because, to do what we do takes a lot of, like a lot of space. You know what I mean?
Mm-hmm.
Like you got to have the capacity and the heart to do this kind of work, because it's not everybody's built for it. And that's no shade at anybody who don't go into it.
No, it's shade.
No,
it's a good, it's a good shade. Like, bro,
I couldn't be a nurse.
Yeah.
But
when I'm saying, when I say
all.
shade, it's like there's certain people that I'm like, bro, you're not good at your job.
There are
like,
some.
like why? Like, you don't like people.
There are some.
You don't like people. Why are you a therapist?
That is a fact. And it's sad to say that there are some bad apples in the profession, just like in any other profession.
Any other profession.
Yeah, just
but
like in any other profession.
But therapy, I think it's super, super, because, like we said, a lot of people coming there for that one-on-one connection.
Right.
And it's like, well, what's the purpose of me coming here if I can't connect with you as a human? You know what I mean? Like, that's, as a human, we can't even connect. We might not, like, I might not like your style of how you are a therapist, but that I can't even connect with you as a human is crazy to me.
Yeah. And I think that foundationally, like, that needs to be there, right? And I think the most effective therapists are the ones that can connect with their clients and understand and remember that you're human too.
Right.
It's like people come to me with things, and I think the reason why I'm able to empathize with them as much as I can is because a lot of times they come to me with stuff that I've dealt with in some form, shape, or manner before.
Right.
It may not be the same exact scenario, but I know what it feels like to be angry, to be sad, to go through depression, to feel anxiety, to lose a friend, to lose a family member, to lose a relationship, to, just be struggling with so many different things. Like, I understand it. So because I understand it, I can relate to you in some way as to what you're feeling. And I just want to hear about it so that I can help you navigate through whatever it is that you've gone through. Not just based off of what I've gone through or based off of like what's worked for me, because there's no one size, fits all approach to this, you know what I mean? Or towards mental health and your healing journey. But I know some things that I have found to be helpful and things I've done research on that has been proven to be helpful too. Let's put together the right package for you and figure out like what's going to help you out. And you'll figure out some things for yourself too. So it's really important. But yeah, you got to have a heart for this. But it is a sacrifice. You're sacrificing time, your emotional capacity, mental capacity, your physical, as well too. A lot of late nights, especially when you got mad progress notes to catch up on.
Oh, the progress notes.
Yeah, I was definitely up till,
Yeah,
I wouldn't be setting a good example. I talked about how late I stayed up last night doing progress notes. But
yeah. So any closing thoughts? Because I can really have this conversation all day long, bro.
Honestly, I forgot we was recording, to be honest with you, because this is what our conversation is
like,
honestly. Yeah. But yeah, my closing thought is, if ever you feel as though that you are in need, if you need somebody to talk to, do not hesitate to reach out to someone. Whether it's a family member, a friend, a trusted colleague, any person that that you feel as though like, hey, I think I can talk to this person about what I'm going through. Right. Reach out to that person. If you have that level of trust and friendship and connection with that person. And of course, I'm always going to advocate, seek a licensed, heavy on the word licensed, a licensed mental health professional at that too. There's no wrong way to go about or to start your healing journey than to meet with a licensed professional or to meet with somebody that you trust. So especially the fellas out there, I love what's happening right now. Let's continue the momentum because there's lots of work to be done, but I'm glad to see the shift that's been happening in our community, just as human beings, especially as black people and especially as black men at that. Like we need to make this happen.
Everything that you said is spot on, bro. And like being in this space, I've seen so, like, my eyes I see things so differently.
Yeah.
And now that I have, I can send you the bro.
appreciate
you
that.
don't understand,
I'm
bro.
gonna bring it home, son.
I appreciate you.
I'm gonna bring it home.
So thank you all for listening. Again, this is a We Drive Health podcast, and we're steering health forward and live long and prosper.
Scene 1, take 3. Action.